My name is Ilaniek Zantingh. I'm a psychologist and sexologist in the Antonie van Leeuwenhoek ziekenhuis. It's in Amsterdam, the Netherlands, and it's a hospital for oncology patients. Well, I've been a sexologist for about 15 years already, but in a general hospital. I've worked and also in mental health care institutions, because I'm also a psychologist. So it started a long time ago already. As a psychologist, I specialized in relationships and sexology, and one thing led to another, and that's how I became a sexologist. And about 1.5, almost 2 years ago, I applied for this job, so that's very specialized for oncosexology, for sexual health for oncology patients. Well, my patients are all patients that have had cancer or have cancer, and they get a treatment for that. And either the disease, the cancer, or the treatment damages the sexual health, and then they come to me. Sometimes they come at the beginning, but usually they come when the treatment is kind of over and they're in the phase of, well, rebuilding health and quality of life stage. And then they experience great difficulties in sexual health because of well, the disease or either the treatments. So not only in that phase, also in other phases where quality of life is important. So even in the palliative phase, patients come to me. I see patients I only see adult patients, so ranging from 18 till, well, like 90 years old. Sometimes I think about like 75% of patients are in a relationship, but sometimes I also see individual patients who have, well, difficulties with well, maybe obtaining a relationship or with just the sexual health for themselves. Well, when I started this job, I wanted to connect all sexologists, all people working in oncology and sexuall health in the Netherlands. So I wanted to connect them, and so I started a special interest group for oncosexology with all old familiar people within the ESMN network, like Wout Gienot and other people that are famous and professors, but also people from research that do research, and people from education, so that will either educate healthcare providers or just educate for the general public. And we also have patient participation from the Dutch Federation of Patient Organization for Cancer. So they're also in the group, and we come together. We haven't been together yet for a long time, but in that group, somebody from the ESM network came, Jacques van Langveld, and he introduced the ESM network. And of course, because I was starting in the Netherlands, but it's also good to, because it's specialized. It's sexual health, it's medical, psychomedical sexology, but then also in a certain field, oncology. So it's pretty small area. So it's good to connect with other people working in oncology in Europe and, well, exchange expertise, exchange how do you handle things, how do we get the education, how to get sexual health in the education for nurses and for doctors, and we're all like kind of struggling with the same issues, and I think it's a good way to connect and share knowledge about how everything. There's a saying in Holland, I don't know if it's in English, but we don't have to reinvent the wheel ourselves. Is it in English? Saying, well, that's what I wanted. I don't want to like do it all ourselves and let's just share and get together. That's how I came to the ESMN. I think oncosexology a part of sexual health, and it has, well, we've seen today and we'll see tomorrow, there's a lot of aspects of sexual health, and oncosexology is one of them. I think it's an important one because of the damage that the disease and the treatments have, and that we have a responsibility to have attention for it. But of course there's a lot of other areas and a lot of other chronic diseases that have a huge impact on sexual health, and apart from diseases there's also other issues. So I think it's just a part, I think it's an important part for patients, but also for us as healthcare professionals. Yeah, well, research and clinical care, they're sometimes not as well connected. So either things are being researched that are not really useful in clinical care, or things are really useful but it doesn't get implemented good enough. And I see that in my field, in oncosexology. Sometimes there's beautiful research done with real nice outcomes, but then it doesn't get implemented in care because, well, people are done researching and they continue, and so that's one of the things I would really like to improve, at least in the Netherlands, and I'm part of that, and I can only assume it's also in Europe a good thing to look at that and see how European research can also have an effect for the clinical care in all of Europe. Well, sexual health in general is really, it's a beautiful field because it, well, in Europe, and you've seen today, but the biopsychosocial model is something that is very, it belongs, at least in the Netherlands, it really belongs to sexology. So you look at sexual health, you look at sexuality from all of these angles, and we also, and you can see that from how we work in the field, because there's not only doctors doing this or only psychologists. We have to work together, and that's what makes it complicated, but also very rewarding. It's not very mono, but it's of course it's something that in general health should be more thought about by the biopsychosocial. That as a person you're a person. You're not just a body. But I think in sexual health, at least in the Netherlands, that's something that's really rooted in our thinking, and you can see that from the care, from the research, from it's always from more sides. And as a young researcher, yeah, I don't know. It's well, for me as a psychologist, I don't know if this is relevant, but for me as a psychologist, I was also a DJ. Well, this is not relevant, but I was a DJ and I worked for radio. And I was thinking one time when I'm like an old and wise lady, I would like to be on radio. And what is like an issue that everybody encounters, either positive or negative, or everybody has to kind of deal with it. That's with relationships and sexuality and sex. It's kind of like everywhere. And that's what the issue or the topic was interesting for me to like continue myself in and see like, well, if I'll be on radio maybe one day, then it'll be with a topic that everyone relates to. So that's what was my motivation. So maybe that's for others also a way of thinking like, oh yeah, it really has an impact.